Well, good afternoon, and thank you very much for inviting me here this afternoon. It's a real pleasure to come to a conference like this and to be able to consider the actual emotional, psychological impact that cancer or a melanoma diagnosis can have, and then to think a little bit about where Maggies can help with some of those challenges. So I'm centre head at Maggies in Cambridge, and alongside that work as a cancer support specialist within the centre. So what I'd like to do over the next 20 minutes or so is really just to give you some overview of the organisation, what we do, what the history and the background to Maggies is. I want to try and give you a few facts and figures that will put some of that into context for you. I think it's really important that we think about the evidence base that's out there. We've heard a lot on the clinical side today about evidence and research. I think that's quite important that we consider that with the psychological and emotional impacts as well. I'm going to try and think about the actual impact that melanoma itself has and some of the specific issues related to that. Then focus a little bit on the programme of support that Maggies offers. And then consider, why do we need to bother? What's important about addressing the psychological well-being of people who have been affected by this disease? Okay, so what is Maggies? Well, we're a national organisation that's been around now for over 20 years. It was the vision of Maggie Keswick-Jenks, who was a lady diagnosed with breast cancer in Edinburgh. And she'd had a really bad experience following her diagnosis of metastatic breast cancer. She'd been given the awful news in a cold clinic, was sent out into a waiting room, with absolutely no space to process the information she'd been given. And so at that point, she had this vision that she desperately wanted to ensure that anybody affected by cancer would be able to have a space that was conducive to well-being, with professional people to offer support at a point when they most needed it. So it needed to be in the grounds of the hospitals, and that was her real vision for having something close to the oncology centres. So I'll just go back. So as I said, we've got 23 centres throughout the UK and indeed overseas. We work in close partnership with our NHS colleagues and primary care. Primary care has become more important for us as we've gone into stratified follow-up, and more patients are discharged at an earlier stage. So it's important that if patients are developing psychological distress, probably our primary care teams are best placed to recognise that and to signpost patients. Within each Maggies Cancer Centre, you find a small professional team, and they're made up of cancer support specialists, a full-time clinical psychologist, and a full-time benefits advisor. And that core team is supported quite heavily by a number of sessional staff. And I'll talk a little bit about those when we look at what the programme actually entails. So really at the core of what we're about, it's looking at the psychological, the psychosocial, the emotional, and the practical support of patients affected by cancer. And it's not just the patients. We are open to anybody affected by cancer, so all of our programme is accessible by family members, friends. We'll often see teachers if they've got a child in their class who's got a cancer diagnosis, or a parent that's got a cancer diagnosis. And in fact, we do a lot of support for the NHS colleagues as well. So if they're working with patients that may trigger some emotional distress for them, then we're very happy to support them as well. As this is a national conference, I thought it was quite interesting just to give you some visibility of where our geographical centres are. This map, it's not desperately clear, but the two centres that we've opened since this map was designed, we've since opened Cardiff and Barts, so they're now fully functional Maggies Centres. And you can see that we've got overseas centres in Hong Kong, China. We've literally just opened Barcelona, that was 2 weeks ago, and also in the Netherlands. Now, for those of you who don't live geographically close to a centre, we've also got our online centre, which you can sign up to and have direct communication with a cancer support specialist, nutritionist, psychologist. So all of the services you can access within the physical centres, you're able to access online. And actually, for some people, even if they're close to a centre, they might prefer almost that faceless interaction. So it's about finding out what people prefer. So I alluded to, I alluded in the first slide around the fact that Maggie had this vision for a lovely space to go following a cancer diagnosis, and in fact she was an architect, so she totally understood the importance of environment on well-being. So when we collaborate with NHS Trusts to build the Maggies Centres, we always enlist quite an eminent architect, many of whom have gone on to win architectural awards for the buildings. So this is just a flavour of what some of those actually look like. But it's not just the external of the building that's important, it's the interior that clearly holds the work that we do. And at the centre of every single Maggies, you'll find a kitchen table, which is so important to enhance that social interaction. And I've heard several times over the last 24 hours that people have found the peer support and the sharing of experience really important. And that's exactly what we see around the kitchen table within Maggies. I just wanted to share this with you very briefly. Some of you might find it quite interesting, but we data collect in Maggies quite robustly. So across all Maggies Cancer Centres throughout the UK and overseas, we sort of have a visibility, if you like, of how many people come through our door with a melanoma diagnoses. And as you can see, between 2016 and 2018, we've seen a steady increase in the numbers coming through, and I think that sort of correlates to what we've heard earlier in the day. What's interesting is that as a proportion of number of new cancer patients that come through our door, just under 2% actually have a melanoma diagnosis, and that's quite consistent despite the numbers increasing. And I just did a quick search on Cancer Research UK, and we can see from that in 2016, 5% of all new cancer diagnoses were attributed to melanoma. So we're seeing probably less than half of the people with a diagnosis within Maggies. Okay, so psychological distress, and what I've managed to do from the literature is find some statistics relating specifically to melanoma, and what we can see is that 30% report a level of distress that would require intervention. So that's looking at things like depression, anxiety. The PTSD, post-traumatic stress disorder, is across all cancer sites, but there's quite a strong evidence base that 1 in 5 patients will demonstrate some symptoms of psychological distress within the first 6 months. What's crucial is, following a diagnosis, is that we are aware that a level of distress is totally normal. You know, just because there's anxiety, there's worry, there's fear on hearing a cancer diagnosis doesn't mean that you're diagnosed with a depression or anxiety. So what we see within a normal process is that generally people have a shock and a disbelief once they hear the news. They'll then move into a state of distressedness, which often we'll see within Maggies or as a cancer nurse specialist, you will see within clinics. But what we tend to see is people then find strategies, process the information, and move into a period of adjustment. When that doesn't happen and people stay in that second phase of the process, that's when we're likely to see the depression and the anxiety and the diagnosable psychological distress. Just put this up very briefly, just to distinguish between the difference of anxiety and depression. Depression tends to be more of a mood change, so people can lose the interest in doing things that they would normally enjoy. They can become sad and irritable, and may actually show signs of thoughts of suicide. Anxiety is a much more physiological manifestation, if you like, of worry. So people can notice or describe the knot in the stomach. They might find that they're tachycardic, their heart's pounding, or they're sweating. So all of those sorts of presenting symptoms we would put down to anxiety. And then there's a few in the middle that really could be related to either. So the restlessness, excessive worrying, and agitation. So some of the impacts that we can see are clearly multifaceted, depending on what treatments people are going through and where the surgery or the treatment's delivered. But certainly we see a big impact on body image, and that can be through scarring, it can be weight loss, weight gain, clearly not so much for melanoma, but if people are having hair loss, that again can be something that impacts on body image. Relationships, that can be partners, children, it can be friends, the wider family network, and also work colleagues. It may be that you've changed your work pattern, or maybe not even working at all. So all of those things will impact together to result in a lower self-esteem. What's really interesting is I wanted to share this with you. One of the things that we see recurrently within Maggies is this element of uncertainty. And what struck me yesterday was when I was reading some of the words that you'd written down, most of them have that theme of uncertainty going through them. So the one off the top of my head, standing at the pinnacle of the mountain, looking down and not quite knowing when that push is going to come. So a lot of the work we're doing within Maggies is around uncertainty. So I'm just going to share this model with you, which tends to be quite a utilised model, if you like, throughout the NHS. But what it's doing is looking at the different levels of distress that we can come across. So that transient distress tends to very much be around on diagnosis, starting to process the information, but hopefully moving through into a period of adjustment. And what we see with that is family, friends, cancer teams should all be supportive within that level of intervention. With more persistent, mild distress, what we expect is that your cancer team should be able to offer that level of intervention. And I think there's been a big move forwards to ensure that all healthcare professionals are able to deliver at least a level 2 intervention, and also identify patients that might need referring on to a level 3. So the moderate distress, there's quite a lot of evidence that psychoeducational information can be helpful, and that's the level that cancer support specialists are working at within Maggies. More severe distress, so the diagnosable depression and anxiety, would require referral over to a clinical psychologist. And then at the pinnacle of the distress levels, we may notice that someone's developing psychosis or have suicidal ideation. And for those, we need to refer them into psychiatry. So within Maggies, we're offering levels 1 to 4 and have very close links with our psychiatry team so that we can refer into them if we're concerned that our visitors are developing psychosis or need further intervention. So the 4 main elements, if you like, of the programme that we offer are around the psychological support, the psychosocial support, information giving and sharing, and also, as I've alluded to, the environment. And what we're hoping to do with those 4 elements is really to build confidence. And it may have been that people have been confident before they get their cancer diagnosis, but that actually impacts on how they feel and how confident they feel to work with their healthcare professionals. We try to build emotional resilience. We want to empower and enable patients, and I think that's to help them to become an equal partner in their care. And again, I think that's one of the key sort of identifiers from the Melanoma Conference, that actually empowering you to have that good relationship with your healthcare team. And then also to become more resourceful. How do you access services and information about treatment options? And obviously events like this support that hugely. So focusing down a little bit now into the programme that we actually do. So we offer psychological support through our cancer support specialists. We've got a team of counsellors and also, as I've said, the clinical psychologist. No one needs an appointment to come to Maggies. So it's quite a unique environment. You can walk through the door and know that you're going to have a level 3 intervention for psychological support if you need it. So yeah, quite an unusual unique environment. And what we try to do as cancer support specialists is really iron out. It's a little bit like the holistic needs assessment, but without the formality of a form. We're trying to find out, what do people need, what elements of our programme would be helpful in moving them forward. We offer the psychoeducational courses. So, for example, the stress management course, we help people to understand the processes that are happening when there's an exposure to a huge amount of stress, so they understand what how that knot in the stomach's working, why they're becoming tachycardic, but then teach them tools and strategies to be able to utilise when that's an issue. We don't want people to just feel good when they're at Maggies. We want them, if they wake up at 3 o'clock in the morning, anxious, to be able to employ some of those strategies to help with those challenges. We've had a big focus on family and children over the past year. It's become really evident that for a lot of our visitors, their biggest concern is, how do I tell the children? What do I tell the children? How do we support the children? So we've worked quite closely with an experienced art therapist who now does one-to-one sessions with the families, and indeed just the children. We've set up children's support groups. We've set up children's bereavement support groups. So if one of the parents has died, we take the children in and work with them with other children who are in a similar situation. We do family facilitated groups. So if communication within the family is challenging, then we're happy to co-facilitate that. And we do kids and family days in total chaos, but we get all the children in. We have an arcade gaming session, we have domino pizzas, we do art, face painting. But what that does is it allows the children to feel confident and safe within Maggies. So if they need some one-to-one more formal support going forwards, then they feel comfortable to come back and see us. I'll just whiz through some of the others because I'm just conscious of time, but fatigue management, exercise, we align ourselves very closely to the survivorship initiative, and as we've heard already this afternoon, exercise and nutrition are all key in educating people going forwards on a healthy lifestyle. Our art therapy is not just for children, we also offer that to adults. Financial benefits, obviously we look at that, we've all heard about the cost of cancer. Managing hair loss, relaxation and mindfulness. We have a big focus on men because there are not so many male support groups out there. So we do that with bacon butties over breakfast, and our clinical psychologist facilitates that. And then we do site-specific support groups in collaboration with our NHS colleagues. So one of the specialist nurses will come over and co-facilitate those groups with us. Okay, so why do we need to worry? And I think, again, there's a body of evidence out there that's suggesting that there's a correlation between level of distress and heightened perception of side effects from treatment. And so what that then means is you potentially see less compliance with treatment. So from a treatment delivery point of view, that's absolutely crucial. In a time when we measure outcomes, not just in morbidity or mortality, but also in quality, and adjustment, then it's really important, if we want to maintain our high levels of outcome measures, that patients' distress levels are kept to a minimum. Economic. We know for a fact with some of our psychoeducational courses, patients see their GP 5 times less in the year after one of the courses than a cohort of patients that didn't do the course. So clearly that has an economical impact on services. And of course, as we've heard today, treatment advances, more people are living with cancer for longer and more people are cured. But I think ultimately what really matters is best summed up in the words that Maggie herself wrote shortly before she died, was her real focus of what Maggie should do, and that's just to make sure that people never lose the joy of living in the fear of dying. Thank you.